Hi, I'm Kevin Price with The Price of Business on Business Talk 1110 AM and nationally on USDailyReview.com. We're here in Oklahoma City for a great event. My good friend, Dr. Goyal and I, we're here covering this event. It's the Free Market Medical Association. Thank you very much. Until about noon, I'll be a little sluggish, but we're going to get going nonetheless. We're going to get warmed up with it. We're really delighted to be able to interview some of the fine people that are here and really capture the story of a healthcare revolution that's taking place here in our country, and kind of feel like a part of that revolution. And I, so many Americans out there are overwhelmed by what's happening with Obamacare and the government takeover of healthcare. And I actually believe that it's going to make the path for this healthcare revolution that we're involved in. It's like the best marketing statement in the world about how government doesn't work, therefore we really need to consider another way. And so, Dr. Goyal, why don't you introduce our guest today, our first guest here on our program. And we're going to have a series of these, both on priceofbusiness.com and USDailyReview.com.
Yeah, absolutely. Like Kevin said, we're going to have a bunch of guests, and all these guests that we're going to bring today are pioneering and spearheading this free market movement. And our first guest is Mark Lockhart, and he is Director of the Corporate Development for Health
Check Screening.
Health Check Screening.
Yes.
Right. Out of Oklahoma City. So Mark, welcome to the show.
Thank you.
Tell us,
glad to be here.
Tell us how you guys are changing the old system and ushering in a new era, basically.
We're involved in the Free Market Medical Association from a diagnostic imaging standpoint.
Okay.
Diagnostic imaging, corporate wellness, they kind of go hand in hand with our model. Basically, our company started out as a wellness company, and we were going to self-funded organizations to do biometrics and things like that, kind of like I think it's called Life Share or something like that. But we quickly figured out that's covered. They've covered a lot of that stuff in their insurance plan, and the founder of our company, Alex McDonald, had met about 6 months earlier with Keith Smith, and that's a name you guys will hear a bunch as you guys talk to the people at this organization. He's the godfather of the Free Market Medical Association, and Alex had met with him, and Keith was telling him, "I'm about to stop taking insurance." And Alex is like, "Are you crazy? What's going on?" Because Alex was a director of an ortho group here in Oklahoma City, and he's like, "How is he going to do this?" We watched, listened, learned a little bit, and all of a sudden the light bulb came on, and we're like, we can do this with imaging. What he's doing with surgery, we can do the same thing with imaging. And so now what we do is we partner with self-funded organizations or third-party administrators, and we say, hey, listen, let us be a provider for these organizations to help lower their healthcare spend by giving them a better opportunity to do imaging, same quality of care, at a much lower affordable rate.
Mm-hmm. Yeah, Dr. Thomas Sowell, one of the great economists, free market economists out there, he said once, this idea of adding an additional layer of cost, like government to healthcare, doesn't make sense if you actually think it's going to reduce costs. The only way it can do that is through rationing, which means people dying before they would normally pass away. And so what you're doing is removing layers of cost.
Sure.
One of the biggest ones is insurance itself.
The best part of what we do is buyer meets seller. You'll see it and hear it, and that's going to be kind of a buzzword throughout the course of the Free Market Medical Association conference. But the thing to me is, if I'm going to go out and purchase a high-ticket item, a refrigerator, a car, I'm not just going to go blindly and say, here, I need a refrigerator, 31 cubic feet, please send that to my house.
Right.
That's essentially what we do in medical healthcare right now. We're taking we're giving the customer the ability to know the price before they have the service. At every doctor's office, you'll hear, please, payment is due at the time services are rendered. Well, I need to know what that payment is if I'm going to pay it. So now we're learning how much a hiatal hernia surgery is. We're learning how much a MRI with contrast is before we send our employees, before publicly we go out and get that MRI or that CT. Knowing that gives you back the power.
Got to wrap up, but why don't you go ahead and your final thoughts on this segment. Let's go ahead and I'll go ahead and mention OurWayHealth.com. Make sure you check that out, and of course priceofbusiness.com.
Thank you for explaining all that to our audience, because this is very important. Take the layers off and bring transparency back, so you know what the real cost of healthcare is when you buy it. And the biggest impact, or the immediate impact, is the self-insured employers. And we were just discussing about how you guys saved a bunch of money doing that with Oklahoma County. So real quick, give me an example.
Direct contracting with Oklahoma County happened with a relationship of our owner and some of the people in that HR department. We went to them and said, hey, listen, let us take a look at your past healthcare spend and imaging. They gave us their data. That's the key. You got to know their data. We got their data. We looked at, they were spending, there were $10,000 MRIs. And we looked at it and we put our numbers together and we looked at them and said, here's what we want to charge. And ever since then, over the last year, over $500,000 in savings in diagnostic imaging alone.
Just in imaging
Just
alone,
in imaging alone.
$500,000.
Absolutely.
How big is this employer?
They've got, I think we're 2,000 eligible employees. Yeah.
2,000 eligible employees in 1 year, $500,000 in savings already just by direct contracting with a seller of services.
Right, eliminating the middleman, which
Absolutely.
we hear in all kinds of commercials for buying cars and that type of thing. We're not going to bring it to this. Restore transparency, end the shell game,
Absolutely.
end the smoke and mirrors.
Absolutely.
And so I love it. Your website?
Healthcheckscreening.com.
Thanks, gentlemen.
We
Very
look
good.
forward to having you guys in Texas soon.
We're looking to go to Texas, anywhere we can put an X on the map, where there are a certain number of referrals that we can start putting in a machine immediately. It's about capacity on a machine. If we can put capacity on a machine, we'll hang a shingle.
Yep. Love it. All right. When we come back, we're going to have more for you. Remember, the show continues 24/7 at priceofbusiness.com. And the best content here, including this interview, will be found over there at the national news website, usdailyreview.com.